In my final message this year, I want to start by thanking NHS staff for the phenomenal work that you have done and continue to do to care for our patients, our communities and our colleagues. We've had another extraordinary 12 months. From January, when hospitals admitted 100,000 patients with COVID in a single month, while also delivering the world-class NHS COVID vaccination programme, to receiving the George Cross during the summer, marked by a service at St Paul's, while of course also making progress on recovering backlogs of care and now facing the uncertainty of Omicron and winter pressures. The pandemic is the greatest challenge in the NHS's history and the defining challenge of our professional lives. NHS staff, our colleagues in the care sector and other key workers are once again at the forefront of a new national mission as the whole country faces the threat posed by Omicron. In the last couple of weeks, I've seen again the incredible NHS Spirit as we work at record speed to turbocharge the COVID booster programme and protect communities against the Omicron variant. There are so many amazing stories I hear every day of colleagues going above and beyond to keep our patients and communities safe, working round the clock and battling Storm Arwen to deliver jabs. These examples and many more demonstrate that we won't rest until everyone who needs us is protected. And it shines a spotlight particularly on the work of primary care, including GPs and community pharmacy, who continue to deliver the lion's share of the vaccine programme. The public response to the national mission of Omicron has been incredible. Since September, over 18 million people have booked in for a booster and more than 25 million people have had their top-up. And in just over a year since we launched the biggest and fastest vaccination programme in health service history, more than 108 million COVID vaccinations have taken place. We know that first and second doses absolutely still matter, and teams are working hard in partnership across, of course, our local communities to ensure no one gets left behind. More than 1 million first and second doses have been delivered in December alone. If you would like to help with this extraordinary team effort, then we are just urging former staff, students, volunteers, please do go online, find out how to get involved. Alongside the NHS vaccination programme, staff have continued to be there for our patients who need urgent care and so much more besides. Colleagues answered the highest number of 999 calls for any November on record. The NHS mental health crisis support lines, which were fast-tracked during the pandemic, have managed between 180 and 200,000 calls per month, with less than 2% of calls resulting in A&E attendance. And more than 450,000 people have started treatment for cancer since March last year, and there were more than 225,000 referrals for cancer checks in October alone. And of course, the NHS has also pulled out all the stops to tackle the impact of COVID on other services, including performing more than 3.5 million more diagnostic tests so far this year compared to the same period last year. While maintaining and expanding routine care and fighting the pandemic, we've also rolled out and accelerated some of the most advanced treatments in the world, including for spinal muscular atrophy, type 1 diabetes, sickle cell disease, cystic fibrosis, and hepatitis C. As well as these treatments, we've introduced the revolutionary Grail test for cancer, which spots the disease before symptoms even occur. And we're delivering extra services for conditions that really matter to people's ability to live well, like long COVID and childhood obesity. In the NHS, we are immensely proud of these inspiring advances in patient care, and we're going to keep innovating, keep using cutting-edge digital transformation, even as we face the current threat of the Omicron variant. I know it's a worrying time, professionally and personally, for everyone, and that many colleagues are drained after such a gruelling period. I've said it before and I'll say it again, the NHS is nothing without its incredible staff. And this time, thanks to NHS staff and volunteers, we are armed with the protection offered by that first, second and booster doses. But colleagues will be working exceptionally hard through the Christmas period across all of our services. And I really hope that you and the public are able to spend some time with your loved ones. My very best wishes for this festive season to all health and care staff, to the public and to everyone who has helped the NHS deliver another extraordinary year.